with it, because we are in peds, so the fun shirts are great. Attendance, it sounds like you have a perfect attendance, which is glorious. When you're scheduled for shifts, it's expected that you're here. Obviously, life comes up, just try to give as much notice as you can if you are feeling sick or just need to take a day off. PTO requests, my preference is to always have a front desk out there, so just trying to look at our calendar and see when the other one has, and just coordinate it as best as you can. Sometimes life happens, and you'll both be out. But I like to avoid that if at all possible. Personal cell phones are not used while you're up there just because HIPAA. Yep.
Yeah.
Yep. So that can be reserved for if you're taking a quick 5-minute lunch. We don't have a paid lunch period. You're just eating while you're at the desk.
Okay.
If you are interested in a lunchtime, we would probably just have you start at 9 then, and we could schedule you a 30-minute lunch somewhere. Right now, most of our PSSs just work the 8-hour shift without a lunch.
Yeah, I just eat whenever.
Yeah, okay. Perfect. Perfect.
I'm used to eating my lunch in 5 minutes.
There you go. There you go. What did I forget?
I think you got it. Holidays?
Oh, yes. We have 6 recognized holidays. They are not paid, but you can use your PTO for that time if you would like.
Yeah.
Since our clinic is closed, I can't offer you work for that time, but that's another benefit of having the PTO is you could get paid for it with your PTO time.
And you mentioned that the hours would be 9:30 to 5:30?
Yes.
Which are perfect.
Yes. Yep. Rachel, did you want to kind of dive into PSS role?
Yeah. So we do a lot in the front. I know you've talked about having a lot of medical experience. What we do in the front office, just an overview. We'll get a referral. We have digital fax.
Okay.
Call for patient, see about scheduling, and then it is a PSS responsibility that we verify the insurance. If the insurance requires any authorization, that we then get that authorization. We put all our details in, attention to detail, correctly, and build that chart. Have the patient in. The patient then goes and sees the therapist. Therapist comes up and says 2 times a week for a year, and then we schedule. In peds, they have a spot. Now we're Wednesday and Friday at 3, and this is my spot, right? And so you're scheduling that out, and taking care of that with the patients. We don't do our billing. We have a central billing office, so we just have to get all of the insurance information done correctly up front, and then that gets sent out. We do some accounting tasks to make sure that that's all correct. Any co-insurance or co-pay is collected at the front. There's a report at the end of the day to balance that. Plan of care. So when we have that new patient in, Jimmy comes in and Casey writes a note for the plan for 2 times a week for 12 months. We then need to get that sent to the doctor, right? The pediatrician to sign off on that plan of care. So we're faxing that out, getting it back, adding it to the chart. We're good to go, can continue to see within insurance rules.
Okay.
So all of those things, so constant fax, constant phone. People will also walk in, I think I would like to come here. I'll have older gentlemen, I don't think this is the place for you, sir. But let me refer you to my adult center. There's 12 in Alaska, and there's an adult center just off the road for Select. So we're doing all of that. Scheduling, and then we're a team. So okay, you're talking about okay, I finished my task list. What's left? Okay, let's go flip the laundry. Let's clean the sensory room. Let's go see what anybody needs. How can I help you? So just working as a team and keeping our clinic clean and hygienic and safe for our patients is always part of what we do as well. And we do run a certain amount of reports, and we have several programs here to learn because this clinic has PT, OT, speech, and ABA.
Okay.
And they're all a little different, and you're scheduling within preferences, and just learning that schedule is a big piece as well. Customer service is key. People are people, and not treated like numbers when they walk in our door. Yeah, these are families. So, yeah, we do it all in the front. There's no one in the back doing insurance. There's no one in the back doing reports. There's no one in the back shopping for the clinic. You do everything in the front in our tiny waiting room with 12 families of 5.
Yep.
Yeah, so it's very, very busy.
It's to do a lot.
Yeah.
Good overview. Yeah. There's a lot to do. A lot of things. We just threw a lot at you. What questions do you have?
Well, like I said earlier, I'm used to working with 30 doctors or one